wasn't very long ago that diseases like diphtheria and polio killed and disabled millions of American children. And while those illnesses have been virtually eradicated in this country, tuberculosis remains a rare but real threat. According to state health officials, TB cases in Massachusetts are down from 215 in 2012 to 201 last year. The news is not all good, though. Of those 201 cases, 7 of them were multi-drug resistant, making them more difficult to treat. That's more than state officials have ever recorded. That worrisome trend is mirrored in the findings of a global study of childhood TB just released by Harvard and Brigham and Women's, and is brought into living color in tonight's Frontline documentary, TB Silent Killer.
When they told me that she has TB, I felt so miserable. TB is the disease that can kill my sister.
The release of the Frontline special and the new study from Harvard and the Brigham coincides with World Tuberculosis Day. My next guest is one of the study's authors. Mercedes Becerra is an associate professor of global health and social medicine at Harvard Medical School. Thanks for joining us. Although most of the TB cases are found in China, India, Russia, and of course Swaziland, there are comparatively few, dramatically fewer in the United States. So how much risk is there here in Massachusetts and in Boston? Also considering that there are many foreign-born residents and travelers here.
I think the risk is much lower here than in the rest of the world. That's what's important to think about. And even though there are a lot of immigrants in the Northeast and other parts of the country, that's not the reason that there would be a lot of risk. A lot of risk would be in, among populations that are very vulnerable. So people who can't access health care, who are sick for other reasons, often the ones who get TB.
Tell us about the scope of the problem of children with drug-resistant or multi-drug-resistant tuberculosis. How large is that problem, and why is it a threat globally?
Well, one of the best ways, I think, to understand the tuberculosis epidemic in the world is to think about what happens to children. And children, the vast majority of TB cases in children could be prevented because TB is airborne, and TB, you get infected usually by the people closest to you, and that's especially true for children. So children are more likely to be infected by someone they know, caregivers, family, whereas adults could have gotten it from someone else. And children get sick faster than adults. So what that tells you is that we reported in our study that 1 million children a year are getting TB, getting sick with TB in the world. And we think the vast majority of those child cases could have been prevented if we were doing a few things that we're doing well in the U.S., but we're not doing well in the rest of the world. And those two things are looking for contacts around every TB patient we find. In the U.S., that's been one of the reasons that the rates have decreased a lot, decreased to such the very, very low rates, because we're looking for people who are sick around the first person we find. And also preventive therapy. Preventive therapy is very effective. It prevents you from getting sick if you're infected. And both of those things together really have to be done to prevent disease in adults, but especially in children.
You started to touch on the way that it can be communicated or spread. Tell us a little bit more about that. Remind us of how easy it is to transmit TB. It can be breathed, I understand, or in almost any public place it can be transmitted.
That's right. And you can, you don't even have to be in the same room with the person. You could be, if I'm sick, I could cough and the air could become infected and then you could breathe it in. So it isn't something that we can eliminate all our risk from until it really goes away in the whole world. And that's what the most important, I think, message is that even though we've done a very good job of reducing TB in the U.S., the lessons that have been learned here really have to be applied in the rest of the world.
Can you explain a little more about why there is such a prevalence of multi-drug resistant TB?
Sure. The treatment of all infections always leads to, if you use an antibiotic, you generate resistance. You select, or you are left with bugs that are resistant to that drug. And so that's what's happened with tuberculosis, like any other infectious disease. But what has to happen is then you have to have new drugs to treat those resistant cases. And that's possible. Even the drug-resistant TB strains that are around in the U.S. and in the rest of the world are still treatable. The treatment course is longer, and the drugs are more toxic, but they're still treatable. The most important thing is to find those patients earlier, not let them be infectious, continue to spread to other people through the air. So that's the really important thing about all these TB strains are spread through the air. So we can treat them, but we need to find cases, treat them correctly and promptly, and find all the people around them, including children, and prevent them from getting sick.
And there's no reason not to be vaccinated for tuberculosis, briefly.
There's actually there's a vaccine that works to prevent severe disease in children, and that's used in most of the world, but that's the only thing we have. There's a lot of work still to be done, and better drugs and better vaccines.
Mercedes Becerra, thank you for sharing your expertise.